Hello, and welcome to this episode of In Discussion With from Pharmacy Update Online. Today I'm talking to Hannah Beba about the use of GLP-1 agonists in type 2 diabetes, and also about the role of the consultant pharmacist in diabetes. So please, could you start by introducing yourself?
Hi, my name's Hannah Beba. I'm a consultant pharmacist for diabetes across Leeds Health and Care Partnership, which is part of West Yorkshire Health and Care Partnership.
Now, I want to focus on GLP-1 agonists. They've been in the news a lot lately, and I'm hoping that you can put them into perspective for us. Can we start with a brief recap? What do GLP-1 agonists do for people with diabetes?
Yes, I mean, GLP-1 agonists have been around for a good while now. We started off with some pretty basic molecules that had to be injected more than once a day, and we're getting now to sort of these weekly subcut injections. And, you know, the general gist of it is it's something that our body produces. Our body already produces GLP-1, and this is something that basically we've recreated that. So it's a peptide, and it acts on the GLP-1 receptors, and that has a plethora of different actions. So it increases insulin secretion, it decreases your glucagon secretion, it maintains and possibly increases your beta cell mass. So that speaks to, I suppose, the durability of that therapy. So some therapies like sulfonylureas you'll find work really well early in disease, but not so great later on. Whereas actually, what we know about GLP-1s, and perhaps something that will change as we move into this era of the incretin therapies, I think probably what will happen is we'll think about using these earlier for their durability and the fact that they'll maintain people's beta cell mass, which is really important. Actually, we don't want to flog people's beta cells to the point where they've got none. So actually, these are really useful therapies for that. And also it delays gastric emptying, which also creates this feeling of satiety, and so you don't feel hungry, and you'll feel less hungry over a longer period of time. So it means that people just don't want to eat the portion sizes that they would have done previously. People who do try to carry on eating as they were often will feel sick and nauseous. So that speaks to the counselling that we need to do around, do make sure you start to reduce your portion sizes, otherwise you will feel a bit pukey. So yeah.
Just for clarity, what is an incretin?
So incretin just does exactly what I've just said. So it's just something that your own body, it's a peptide, and it does all the things that I've just explained with the GLP. So it's just about all the things that I explained right at the beginning. It's just about making you feel fuller for longer, making sure that you decrease your glucagon secretion, increase your insulin secretion, all of those things. That's what your incretins do, all of them together in a coordinated way.
Now, there seems to have been a plethora of new products in this field recently. Where do tirzepatide and retatrutide fit in?
Yeah, so tirzepatide and retatrutide, these are what we call dual and tri-incretins. So the tirzepatide is a dual incretin, so that's a GIP, GLP, so two incretins. So you're getting like double bang for your buck, if you like, with that. And tirzepatide, again, injectable, designed to be a weekly injection, very, very efficacious. So more efficacious than any of the other GLP-1s that we currently have on the market. Trials have been really impressive so far. Obviously, we need to see the real world data where this isn't released yet. So I do always remain slightly skeptical about tolerance, I suppose, until we see that landing. But everything in the trials suggests that they're as well tolerated as any GLP-1, similar side effect profiles, etc. So what they saw, so the SURMOUNT-2 trial results were released at ADA this year, and what they showed was that about more than sort of 45% of people who are put on, the incremental dosing of tirzepatide will reach normoglycemia, which is incredible. And over 80% will get to a HbA1c of less than 7%. So in our money, that's 53. So really, really good. And also this weight loss as well associated. So getting more weight loss than some of our weight loss drugs. So it's quite it's nice to have that. And that really, what I find is that yes, it does the impressive what we want them for, I suppose, in diabetes is we want the glucose well controlled, but the weight loss, diabetes, type 2 diabetes is about obesity. It's about where you hold your fat as well. So people can look not obese, but it's where they hold their fat around their liver. So if somebody's got non-alcoholic fatty liver disease, for example, particularly this can be a problem in certain ethnicities. So South Asian people tend to hold more fat around the liver, which leads to sort of earlier development of diabetes. And these drugs are very efficacious for managing that. So you're getting anything sort of 15% or over of weight loss with these drugs, which is really, 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 really good. And that's really what people care about. If I'm being absolutely honest, if they start getting some significant weight loss, it completely inspires them to carry on. And then they'll even make more lifestyle changes. What you find is people just need to get over that hump of getting nowhere with diet and lifestyle. And I think sometimes if you start giving them a bit of support around the medication, that inspires them to do more with their other stuff. So they will then start to exercise because they're feeling better, they've got less weight on board, and they can mobilize more easily. So it's kind of then a domino effect, and you just find that everything kind of starts to fall into place for them. So I've seen incredible results even with the GLP-1s that are currently on the market. So I've got high hopes for this one, Christine, tirzepatide, most definitely.
Mm-hmm. And for retatrutide?
This is a tri-incretin. So this is added in a glucagon to the mix. So we've got a GLP-1 glucagon GIP, and that had their Triumph trial released, which is just in phase 2 at the moment. So we're much further away with that. It's still quite a long way off market. Also produced by Lilly. So Lilly's pumping out these incretins like mad, and they're looking at what they've done is they've had this specifically looked at a very high risk a sort of collection of diseases. So they've looked at somebody who's got obesity with non-alcoholic fatty liver disease with type 2 diabetes, and again even more efficacious than tirzepatide. So we're looking at 20 to 24% weight loss, which is incredible, and again decent similar side effect profile. So I think with any of these things, you're thinking, oh, these are going to be as well tolerated. You might get the efficacy, but if people can't take it, but it seems that the people in the trial have managed it, and so yeah, we'll see. High hopes for that one as well.